Hi, my name is Megan Jacko, and you might hear about the cloud all the time. Today I'm going to talk about why I'm personally interested in studying the cloud, digital records in the healthcare industry, and in particular, how cybersecurity connects with the cloud and digital records in the healthcare industry. Why healthcare? Well, healthcare is something that is all around us. Many of us know nurses. Many of us know doctors. Many of us know people who work in hospitals, clinics, etc. I know that for me, I grew up with it all around me. My mom was a nurse practitioner. When I was growing up, she worked 2 different jobs for this. So she was in hospice, working with people who were terminally ill, and also then later pivoted to working in neuro-oncology, people with brain cancer, also terminally ill. And so I grew up with this understanding of patients who would not make it, and that great care could be provided with them in a really passionate manner, and that could be something that you did as a profession. And it was a really big deal, like that could be a job that people did. And it interested me that was a job that people did. It was not something that I personally wanted to do. I thought, that is a great thing, that people go out there and do that and provide that care for others in their time of need. And so as I work in my field in threat intelligence, in information security, I was really interested in what do people who are in healthcare, what's their understanding of cybersecurity? What's their understanding of their use of the cloud? They use records all the time. They're charting. They're using digital records. They have to have 100% use of those records for the best patient care. We call that uptime, 100% uptime. If the hospital digital records go down for any number of reasons, it could be because there's updates. It could be because there's technical issues. It could be because there's a cyber attack. For whatever reason, if those records go down, there can be patient issues that occur. And so I was curious, what is the understanding of the people who are using those records? Like, what do they understand regarding the cloud and how the cloud exists, how those records are stored, how cybersecurity works? And so that was something I wanted to study. I was fortunate enough to meet someone last year at the Women in Cybersecurity conference who was also interested in studying this with me. So her name's Remy Cohen, and so she has been doing cloud security research for years and years, and so she and I partnered to work on this study, and we decided to work on a survey to ask people in healthcare in a variety of different positions. We didn't want to just get one position, one country, etc., what their perceptions were. And so that's how we designed our survey. And then we also wanted to compare that to the leaders in cybersecurity. So we call these people Chief Information Security Officers. Or maybe that's not the title at the organization, so it could be maybe IT leader or cybersecurity leader. So whoever that leader is in the organization from a cyber or IT perspective, we wanted to interview them and then compare what their thoughts were about records, cloud use, cybersecurity use to the end user's use. And so that is why we started to study and why we're hoping to get more people participating in it. And of course, everyone's busy. It can be really hard to get people answering a survey. So my hope and my request is, if you know someone who is in healthcare, if you would be willing to send them the survey, if you're in healthcare, if you'd be willing to take the survey, that would be greatly, greatly appreciated. And thank you for doing the work that you do. If you're a leader in the healthcare industry and in IT or cyber, and you would be willing to be interviewed about this, please reach out. And all our contact information will be within the links within this video as well too. Thank you for taking the time to watch this, and thank you for the work that you do. Have a great rest of your day, and carpe diem.